armbar and dislocated elbow at UFC 263. I'm back. I'm Dr. Lucius Pomerantz, board-certified orthopedic surgeon, specialist in surgery of the hand, and black belt in Brazilian Jiu-Jitsu. Please note, if you get squeamish seeing arms bend in ways they shouldn't, then this video is probably not for you. This video is going to be a continuation of our armbar series. Part 3. This one was inspired by events during the recent UFC 263 in the bout between Scottish submission artist Paul Craig and the previously undefeated Jamahal Hill. It did not go well for Hill. As a reminder, because I'm supposed to do this, please remember to like, share, subscribe. But really, if you like this, then you've probably already done it. Thank you. Also, you should probably take a look at my prior armbar videos. In the first one, I talk about the mechanics of the armbar and how, if it is applied well, it attacks the elbow joint, which could result in a dislocation, famously demonstrated by Ronda Rousey a few years back. In the part 1 video, I did not go into much detail of the treatment and recovery of elbow dislocations, so that is what I'm going to do a bit of in this video. So back to the fight. Craig takes the fight to his world, the ground. Hill makes the mistake of having his posture broken and his arms trapped. Now, this is a well-executed, straightforward armbar that Craig attacks with. In trying to alleviate pressure, Hill ends up going to the ground himself, but it is too late. The arm is locked in and the elbow joint isolated. The elbow joint fails. Craig knows bad things have been done to the elbow and actually looks at the referee, who does not seem to notice. Hill does not seem to be convinced either, as he does an awkward motion with the other arm, but does not seem to distinctly actually tap or verbalize submission. The referee is right there and definitely did not seem to make it a straightforward decision by calling out for the end of the fight. But still, about 22 seconds after his dislocation, the fight was finally stopped. And then, I'm not sure if Hill insisted on being there for the hand raising. Not sure what he was going to do still out there, but I'm glad that he had his elbow joint reduced, since, to my knowledge, there are no x-rays out there of Hill's specific injury. I will presume they look something like this. This is a posterior dislocation of the elbow, and I feel this is a classic injury pattern as a result of an armbar that goes too far on the elbow joint. Now, for the treatment side of things, the doctors would do an exam to make sure the nerves and blood vessels are working. Then it is time to make it better. The doctor who manipulates the elbow back into the correct position will perform a reduction maneuver. And I want to make it clear, this should be done by a medical professional. The reduction maneuver for a posterior elbow dislocation can be simplified as pushing the humerus backwards. Usually this is pressing it against the table if the patient is laying on their back, and pulling the ulna and forearm away for traction, and then forwards. There are several variations, but this is the general idea. When reducing these dislocations, often there is a nice clunk as it comes back into place, and the patient feels immediately better. Not perfect, but better. An exam will then take place to confirm the elbow is working better and there was no damage to nerves or blood vessels with the reduction maneuver. Getting an x-ray afterward is important to make sure reduction was achieved and there are no other injuries, such as a fracture. With traumatic first-time dislocations that are reduced quickly, if the patient is careful, surgery is unlikely to be required. Often the arm will be held stable in a splint for a week or two to rest the elbow, but never more than that. As mentioned in the first armbar video, elbows tend to get stiff, so it is really important to get them moving as soon as it is safe. Soreness and stiffness will persist for a while, often longer than 6 weeks. Those ligaments in the elbow that we have talked about previously are stretched or torn, and it takes some time for them to heal. Starting at 6 weeks, the patient can usually begin more aggressive movements without restriction. They can get back to combat sports after that, when their arm feels all right. And hopefully, lessons were learned, or they will tap sooner the next time around. If you have any questions or comments, please leave a message below. I'm Dr. Lucius Pomerantz. Let's keep moving.